Pneumonia and tuberculosis are some of the things that confuse mothers. When we are pregnant, we are prone to getting any of these conditions. The reason as to why it is so is because our immune system is kind of suppressed when we get pregnant, because the body focuses on the growing baby inside our stomachs. Pneumonia basically is a respiratory disease that is characterized by chest pains, high fevers, and cough, especially dry cough. It usually occurs whenever we are exposed to the cold. It is one of the things that we are prone to getting during this time, especially when it is very cold. If you stay in a very cold house, if you stay in a house that sometimes gets mold in it, those are things that could actually predispose you to getting pneumonia. Now, pneumonia can be very dangerous to our babies or our pregnancies because it increases the risk and chance of us getting abortions or preterm deliveries or prematurity during pregnancy. So you do not want to get to a point where you are in there. Keep yourself warm. Wear socks if you're a mother that can be able to wear socks. Of course, I know it is very uncomfortable during this time, but have those slide-ins where you are able to keep your feet warm, especially, and a warm body keeps you healthy. Eat healthy, eat a well-balanced diet, because you don't want your immune system to be suppressed during this time. And also, go for treatment as soon as you realize that you have any of those signs. Tuberculosis, on the other side, is also almost the same as pneumonia. That's why I wanted to put them in one talk so that we can be able to tell the difference. However, for tuberculosis, there is an addition of night sweats on top of the chest pains, the dry cough, and sometimes you can have sputum that looks like rust. It's a rusty kind of cough. Whatever you cough out becomes like that, and sometimes it can actually become purulent. So you would want to go for a checkup when you realize you're having night sweats. Yeah, they are usually night sweats. You don't have them during the day, but whenever you go to bed, you have those night sweats. They can be very uncomfortable. If you have night sweats, it is good and it is in order for you to report that to your healthcare provider so that you can be able to be assisted. Tuberculosis in pregnancy can cause abortion. It can cause fetal growth retardation. It can cause prematurity. It can cause a lot of things, low birth weight. You do not want to get to that point. So these are things that can be treated and managed. As far as tuberculosis is concerned, it can take a while. So that means you do not, if you're a person who doesn't finish your dose of medication, you need to be very serious with tuberculosis medication, because if you do not finish your medication, you are at a risk of reoccurrence, and you do not want to get to that spot. So if you realize that you're experiencing those, on top of whatever I have mentioned, there is, you have body weaknesses, muscle weakness, you have fatigue, it's like you're fatigued all the time, please go get checked and make sure that you have a clear system that is showing you exactly what is going on in your body. Do not self-medicate. If it is a simple cough that you are always used to self-medicating, please do not self-medicate, because these two can actually be deadly. They cause the lung insufficiency already in your lungs during pregnancy. There is an overtasking, because you have to provide for yourself as a mother and for the baby as well. So you do not want to be in a spot where you are just self-medicating at home. Please avoid that. If you have any of those signs, go get the right treatment.